ABC Wednesday.
I'm Joan, and I'm your first Golden Bachelorette.
Joan's getting a second chance.
This is about everybody like me, navigating, trying to find love at this age.
I wouldn't be here if I didn't have hope.
Because love never ages.
Golden age doesn't mean you're old. Old is a state of mind, like a lot of living to do.
The Golden Bachelorette. Series premiere Wednesday on ABC and stream on Hulu.
And though you will try to always get it right, the beauty of life lives inside of you. And I hope someday you find it too.
You've heard all the ads and seen the shops for CBD, and maybe you've wondered, what's the hype? Cannabidiol is known for its ability to provide non-habit-forming relaxation, and now you can have it in a convenient nasal spray. You can take it anywhere. Just go to simplyherbals.net. That's simplyherbals.net. And check out Dr. Scott's Buffered Saline CBD nasal spray. Just a couple of toots. You'll see why he's America's top CBD nasal spray. While you're there, check out his line of supplements from fatigue reprieve to stress less. Dr. Scott has it all. That's simplyherbals.net. Simplyherbals.net.
I don't care. My jokes don't go over, I don't care.
Wow, that is very interesting. Please tell me more.
He's a fucking idiot.
Man, you are one pathetic loser.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Gino Bisconte Network Studios in beautiful downtown Tukey City, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred. The whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And NP Mel B, back from sabbatical. Thank you, NP Mel B.
Well, thank you for having me.
This is a show for people who have never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call. 347-766-4323. That's 347-POO-HIT. Follow us on Twitter at Weird Medicine and at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking over with your healthcare provider. All right, very good. Don't forget stuff.drsteve.com, stuff.drsteve.com. Back in business, just with a different affiliate agreement. And check out roadie.drsteve.com for the Roadie robotic guitar tuner. Also will tune mandolin and bass and some other stuff. And NP Mel B, you are interested in getting the Roadie coach.
Yes.
And learning how to play an instrument, because you do not know how to play.
I do not know how to play any instrument. Well, I can play Mary Had a Little Lamb on the piano, but I don't think that counts.
Okay, you're the perfect person. So they've been bugging me. Hey, we want your review on the Roadie coach, and I gave one to DNP Carissa to learn ukulele, and then she left.
No.
So she's playing ukulele in New Jersey with her paramour. So, and then I gave one to another person, and she didn't want to be on the air, so there you go. So
I want to learn.
Okay.
I want this to be my new hobby because I want to sit up here and play music with you guys.
Oh, God.
Oh, Lord.
That is my goal in life.
Well, don't worry. It won't take you long to
No, it won't take you long.
Well, and I
for
also think that men that can play the guitar are very sexy.
Really?
Oh, yeah.
Yes.
Well,
I mean,
there you go.
It
Too bad
adds.
Scott can't actually play the guitar. You might make some time there.
Scott's sexy.
I can play the guitar, just don't play it well. Thank you very much.
So my theory is if men are sexy, are women sexy? So I want to find out. I want to learn to play
It
something.
always is interesting to see a woman just shredding the guitar, because it's not what you're used to.
Right.
But I think it's pretty fucking cool. I think everybody, anybody can play. I appreciate virtuosity wherever I see it.
Mm-hmm.
Plus, I've heard that if you can learn to play the guitar, it will help you learn to sing. Like you can hear the notes and maybe sing better.
Interesting. Well,
because I do not have a singing voice.
I would say we have
Not
a
at all.
counterexample right here in the studio. We'll see. Okay, well, that's awesome, though. But yeah, we'll get that for you.
Awesome.
Don't let me forget when we leave today. I'll order it and I'll have it sent to your house.
Okay, send it to my house. But I'm going to need a guitar. We got to get back to
Yeah, I have one that you can take.
Sweet. I'm going to practice.
Okay,
And I'll
awesome.
play on the show. I'll learn to play a song and I'll play something on the show for you.
Okay, that sounds like,
I'm
my God.
going to put her in.
This sounds like such a bad idea.
No, it doesn't at all. But G-Back and I used to play, and then Scott's like, well, I want to play. This sounds shades of, 20 or 15 years ago. But, Scott actually can play now. I'm a terrible musician. He's a better musician than I am at this point.
I feel like I need a hobby.
Yeah.
I can't speak another language. Like my mind just doesn't work that way. I've tried.
Yeah.
I don't know how to play anything. I have no real talent.
Music is a bit of a language, but you may find that once you can play music, you might be able to pick up a language.
Maybe.
Too, so we'll see.
Well, this may lead to a lot of cool things.
Roadie, ROADIE .drsteve.com, or just go to stuff.drsteve and scroll down. You can see what we're talking about. And then unless she moves to Alaska, then we're going to know this roadie coach thing is cursed.
Right on.
But as long as you're still here, then, yeah, we'll have you back and we'll try
We'll talk about
see
it.
how you do. Okay.
Awesome.
Yeah, that'd be great. And the roadie people are very interested in us doing that.
Well, thank you.
Don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. Patreon.com/Weird Medicine. I've been a lot more active there lately. Check that out. I just posted a 5-part classic episode from November of 2009 that is not found anywhere else. And I've been scared to listen to it, although I think that, Anthony Cumia, the first time we did the show, he said that's the best first show I've ever seen anybody do, and then we never got any better. So we're just still doing kind of the same. But anyway, and then cameo.com/Weird Medicine, I'll say fluid to your mama. All right? Watch for, I'm going to be doing some one-off videos. That's what I want to start doing more of. I'm doing one on borderline personality disorder. I'm going to do one on Wernicke-Korsakoff syndrome and some stuff like that. But I'm going to try to make it interesting. And part of it is learning to use DaVinci Resolve, which is an editing software that is used all across the industry. And it is unbelievably powerful. And I'm taking a class on it now, and I want to start doing my own stuff so I'm not dependent on other people to put this stuff out. So be watching for that. In the next few weeks, you should start seeing something trickling out of here. All right, very good. Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. It is allergy season, and Dr. Scott, really the premier creator of CBD nasal spray.
Yes.
It's nasal rinse.
The OG.
Yeah.
The original, yes.
Well, we had that one person call in and say they tried some competing brand and it sucked. So there you go. That made me feel a little bit better.
Yeah, me too. Thank you very much.
But anyway, yeah, simplyherbals.net. Check them out. And Mel B, good to see you. How's your thyroid doing?
Oh, wonderful.
Well, you look great.
Well, thank you.
I mean, you really do. I think that getting that stupid chunk of sweet bread out of your neck.
Yes.
We should have fried that thing up.
I could have had it on I don't know. We could have made thyroid kebabs.
Yep.
Well, there you go.
Crackling bread. But sweetbreads are really, really good. And then I found out they're like goat thymuses or something. And then I didn't eat them anymore. I was like, okay, what is this? This doesn't taste like any kind of actual meat that I've ever had.
Yeah.
And it's not bread and it's not sweet. So, they have to have a euphemism for everything. So mountain oysters, or big giant bull testicles, which I will admit I have eaten.
Oh, gosh.
Oh.
You're such an adventurous.
Well, no, I mean, I grew up. Listen, I had 4 miles. Whoa.
Oh.
Goodness, I just cut myself out. I had 4 miles of dirt road. Let me start that sentence over again. I had 4 miles of dirt road going to my house when I was growing up. And so, I mean, I experienced the whole, Appalachian thing. I don't sound like I'm from the mountains of North Carolina, but that's because of broadcast school. I went to broadcast school before I went to medical school, and they beat your accent out of you. So but I can, if I'm talking to one of my friends now, it comes right back. And I'll, by God, tell you what. And by the way, I got to use my Appalachian dialect today when I went to the Flag Pond Ramp Festival.
Oh, my gosh.
Now, I made, Carissa used to be on DNP Carissa used to be on the show, and she's moved away, with the love of her life, who she met through this show. You're welcome, you assholes. No, they're not assholes, but you're welcome. But anyway, her mom had property in rural Tennessee, and it was covered with ramps. And so I had, pounds and pounds of ramps, and I dehydrated them and pulverized them, and then, did a 7-to-1 mix with kosher salt, made ramp salt out of them.
Gotcha.
Which our buddy from West Virginia probably pissed him off, West Virginia ramp salt. But anyway, I did get the idea from him. And so I, was all excited. When I knew Carissa was moving away, I knew there was this ramp festival. And so I put it on my calendar, and I get up this morning. I got up early. I had a bunch of chores to do, and bing, 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 it comes up, ramp festival today. So I got in the car and ran all the way up there. And you know what they don't have at the ramp festival?
Oh, no. Don't.
Ramps.
I was going to say, don't say ramps.
They did not have ramps. I'm so pissed. I get up there.
Oh, my gosh.
It's 9 in the morning when I got there, figuring that
you left here early.
Yeah, oh, yeah.
Right.
I figured, these guys, it's, a country festival. It'd probably start around 8 in the morning because everybody gets up early. What else they got to do? And I get up there.
In the country.
Exactly.
And we don't have anything to do in the country.
The roosters crowing and dogs are barking.
But, I know. Well, listen, these are my people. So I get up there, and they were delightful, wonderful, country folk. And the guy was, I'm like, do I need to pay for parking? And there was lots of parking. And it was at the school, and they were just parking on the lawn at the school. It's like, it's the lawn at the school. It's going to ruin it. Thank God it wasn't raining. But anyway, this is the least of it. So I gave the guy $20, donation for parking. And I get up there, and there's people setting up and stuff. And I said, I'm here. I said, what's going on? They said, well, it starts around 11.
Oh, shit.
So I had 2 hours to kill. So I helped some guy put his tent up. And then I look around, and it's just a big, long line of these propane griddles. And there's this these people, and they're just cooking bacon and taters.
Oh, wow.
And just griddle after griddle cooking bacon, just, loaded in oil and stuff. They're deep frying the bacon.
Yeah.
And this guy's just looking at me, this old country feller, and he ain't got any teeth. And he's cooking bacon and then eating half of it and just looking at me, just cramming bacon in his mouth.
I thought that's how you were supposed to cook bacon.
Too, yeah.
I don't disagree, but I'm
yes.
coming to Ramp Festival. So
bacon festival.
I asked this lady, do you have any ramps for sale? Nope, I've got T-shirts. So I bought 2 T-shirts from her. And while I'm sitting there, and then I'm like, what in the hell? So the coordinator comes around. I said, where's the ramps? I'm here to buy ramps. He said, well, we ain't got any ramps. We usually go to the farmer's market to get our ramps.
Oh, for God's sake.
Are you shitting me?
Oh, for God's sake.
Are you shitting me? I can't.
So they just all got around to cook bacon.
Yeah, I guess maybe they were cooking dishes, that they were going to put ramps in that they bought at the farmer's market. I had this image that there'd be all these people with like garbage bags full of ramps. I could buy some from them.
Right.
Well, hell, ramp season ended in April.
Oh, so, my God.
So I went to the farmer's market. I had to go to the hospital and see a patient. Mm-hmm. And there was a farmer's market in, right down from the hospital. So I went in there. Do you have any ramps? No. Do you have any ramps? No. Do you have any ramps? No, we ain't had none since April. And it's like, for F's sake. So I'm screwed this year. I'm just going to have to buy ramp salt from old Ramp Salt up there in West Virginia. And there's no ramps for me. But there was a guy who was cultivating mushrooms, and so that was cool. I got to talk to him for a while because that's my new hobby. By the way, everybody knows I have neuropathy really bad, and Scott and I recorded the very final piano performance I ever thought I'd ever be able to do, and it's up on our YouTube. I did a Philip Glass piece called "Opening."
It was spectacular.
Well, it
filming
wasn't spectacular. Yeah,
the filming was.
And then I found out that anyway, there's things I found out about that recording that I should have done better, but I'm not going to mess with it now. But as far as color correction and stuff like that, but it was fine. But I only got to do 2/3 of the piece because my neuropathy I was getting to the point where I wasn't going to be able to play anymore. And I started messing with mushrooms, and I grew lion's manes, and so I started reading up about them. They're supposed to be good for neuroregeneration, right? And so I started taking lion's mane extract, and I'll be damned if I can't play the piano again. I mean, I can't play. I'm no good, but I can physically do it. Yeah. And it's just an N of one, but I can tell you from my anecdotal evidence that it was a big deal. So I went all in on the mushroom cultivation. I thought about, doing a business or something. But I went to the farmer's market. This guy was making, was selling mushrooms that he makes, and he's a nurse. A travel nurse, worked in the ICU. He just does 3 days a week, and the rest of the time he's selling mushrooms. So I bought a big bag of not trumpet, what the hell? I'm having a senior moment. But anyway, king oyster mushrooms. And they have some medicinal properties as well, but, some of this stuff's overhyped. But if you guys want some, I bought like a shitload from him just because nobody was buying anything. Right. I think people look at those mushrooms and go, what the hell is that? Because he's got these big, giant plastic bags with substrate in them, and then these huge flushes, these outgrowths of clusters of oyster mushrooms that people really have never seen around here.
So if you snip off that, I would assume will they continue to grow from the substrate?
Yes, you can. Like my lion's mane, I harvested them the other day.
Oh, good.
I've got some downstairs if you want to try it later. I'll just saute some for you so you can taste it.
They look like cauliflower.
Yeah.
They really, it's crazy.
But I'll saute some for you. I want you to taste it.
I'm scared.
Really?
Yeah, I don't like mushrooms.
Well, this doesn't taste like any mushroom you've ever had.
It doesn't.
I get really upset when I go to the Japanese place and I tell them no mushrooms, and one always creeps in there.
Yeah.
And I think it's a piece of chicken. I put it in my mouth and I want to gag.
Oh, no, yes.
It's a texture thing, though.
I think this might change your mind about this particular mushroom.
Okay.
And I'm not going to try to fool you and say, well, that's chicken, don't you know? All right. But anyway, so I've gone all in on that, but I don't know where I was going with this other than, the one place you'd think you could find ramps was at the Ramp Festival. And they've got these T-shirts. The T-shirts are beautiful with big old picture of ramps. I was all excited when I drove up and saw these people wearing these T-shirts like, by God, I've come to the right place.
I'm with my people.
So I went to the farmer's market, and all these people had like onions and stuff like that out there. I said, y'all have any ramps? They're like, no. And I said, you know where else they don't have ramps? At the Ramp Festival. And people were laughing.
Well, at least you got to enjoy a pretty drive.
I did.
It's gorgeous over there.
And what I found is there is a state park up there, Lamar Alexander Rocky Fork State Park, that has not been activated on ham radio, Parks on the Air, in quite some time. So guess where I'm going tomorrow morning? We'll be doing me some ham radio. Now, speaking of ham radio, which now everybody's click. No, this will be interesting. Ham radio.
Start the timer.
Ham radio was shut down for the last 24 hours because we had a massive coronal mass ejection from the sun.
Right.
Now, this happens when the sunspot cycle, particularly when it gets wound up. People who saw the eclipse or looked at my video of the eclipse, you could see there were prominences on the sun pointing away from us. But what those are is the top part of the sun rotates at a different rate as the middle part, as the equator does, but it's plasma, right? It's ionized gas at an incredibly high temperature, and so it creates magnetic fields. And these magnetic fields start to twist because, again, the top is rotating at a different rate than the middle is, and so they start to twist. And when they twist up, you'll get a north pole over here on one part of the sun and a south pole over here on the other part of the sun. You'll get these tunnels of magnetic field, which then those charged particles will travel along, and you'll see these big wispy sort of arcs of plasma, and they're red. You can see it with the naked eye when there's an eclipse. Because all the people at the eclipse, and when I was in Dallas, there were a bunch of people. And by the way, a lot of them were real blasé. Well, what's this going to be? This isn't going to be interesting. And then they were like, "Holy fucking shit!" Go to my Instagram. It's just Weird Medicine. You can see some of the video that I did and pictures that we took with my solar telescope. And, with the naked eye camera as well, without the filter when the eclipse was total. But anyway, now every once in a while, these tangled magnetic fields will just go, we can't exist like this anymore. And they twist so far that they just they don't really explode, but they just snap. And when they snap, the sun will, and I'm giving you a very simplistic explanation of this, but
I need that.
the plasma that was entangled in that gets flung away from the sun, and at escape velocity. Now the sun is huge, so it's got a really strong gravitational field. So you can imagine to fling stuff away so that it escapes, so it doesn't fall back into the sun. I mean, you take a rock, you throw it up, it falls back.
Sure.
We have to have these giant rockets to escape just the Earth's gravitational well. So you can imagine what it takes to escape from the sun. So these things are under really high velocity and a lot of energy. And if it comes at the Earth, which this one did, the sun was looking right at us and went, here you go. And this big ball of charged particles hit our magnetic field.
Yes.
And now remember, charged particles are affected by magnetic fields. And so they all start to wind down into this magnetic field. And as they do that, they lose energy and they start giving off light. And that's what causes the aurora. Yay. And so we had aurora. Apparently, it came as far as here at 3 in the morning.
I saw it last night.
You did see it?
I did.
Oh, my goodness.
Well, not only that, I have also seen it from Alaska.
Alaska, right.
Yes. Most beautiful night of my life was in Talkeetna.
Ooh, nice.
Yes.
Well, I've seen it in Vermont.
Awesome.
And my ex-wife's kids were texting me last night because they were seeing it from Troy, and I put some pictures on my X, or what I can't call it X, on my Twitter at Weird Medicine. There were some pictures from Troy, New York. They were beautiful, purple and greens and all this
And what
stuff.
time was it?
3 in the morning. What were you doing up there?
Well, I was up at 3 in the morning. I did go back outside. I did see a little bit last night. Well, it was about 2:50.
Damn it.
But no, last night, probably about 10:30.
Really?
We were outside. My daughter lives further away.
Yeah.
She lives like 45 minutes from my house now. And so she called and she was like, oh my gosh, I feel like I'm back in Alaska. And she was very excited.
Wow.
So my other kid and I, we went outside with her friend and
for it to spread this far south, that is a lot of energy.
The back of our neighborhood kind of sits up on a hill.
Yeah.
And it's a little bit darker. So we went up there and sure enough, it was a lot of purple. It was kind of
this was
just
purple.
glowing.
Right.
It wasn't the same that I've seen.
It wasn't the sheets coming down.
No, it was not like the movement and the waves and the beauty that you see further up north, but it was a very distinct green glow on the horizon. And then you could see the pinks and the purples kind of.
Now what that
and now,
does?
now the haze kind of looked like it was waving, but
Right.
it was very cool.
Yeah.
It was awesome.
Yeah, it is amazing.
It made me it made me want to go back.
Oh no, you can't. You're not allowed.
Do it, no.
I'm not allowed to go back. I can go visit.
You can visit all you want, but
Not
you're
moving.
not allowed to stay there.
No,
Okay,
but it was neat.
that's cool. Yeah.
Yeah.
And I've got to do better with the cameras for the people that are watching this live. As you know, Mel B was giving a very, a very impassioned talk about this beautiful event that she saw, and all you're looking at is stupid Scott and me going, "Oh yeah,
Cool, that's awesome, man."
So anyway, sorry. We need a producer. We really do. We need an in-studio producer. Now, we do have Andy Hines from A. Hines Media that's doing our Instagram and stuff now. And so he clips, and he's got a hell of a job trying to find 1 to 2 minute segments that are actually interesting that he can put on Instagram, but we're trying. But anyway, the 3-minute timer's been helpful for that.
It gives you more chances to hear something interesting.
It's so when the atmosphere gets that charged, radio waves are just absorbed by it. But at the higher, really ultra high frequencies, like VHS, I was going to say VHF, you can bounce. It becomes like a mirror, and so the 6 meter band, which is usually dead, was wide open. 2 meter band, which is 144 megahertz, which is close to the bottom. I think the bottom end of the FM dial. Isn't that? Wait, it starts at 89 megahertz anyway, right? I can't remember where FM is, but you might have been able to hear FM stations from far away, last time while that was going on.
That's cool.
Yeah, it's pretty neat. But anyway,
So it's supposed to be still happening tonight.
Yeah,
There's a small
really?
chance that if it's clear tonight, you might be able to see.
Okay.
Last night when we came in
Did you
because
take pictures?
I did.
Okay, just
Well, I've got beautiful pictures I can show you later from Alaska that are just amazing.
Okay.
But I do have some pictures from last night.
You do? Here, pass me your, get one up and pass me your phone. And I'll put it out there. That, the people listening to this on audio, are going to be thrilled by this. But go to youtube.com/@weirdmedicine. Okay, well, you look for that.
It's going to take me
That's okay.
a second.
That's okay. So, Dr. Scott, you brought a story for today, right?
I did. I did. So I found this in Psychology Today, and I thought this was appropriate for you.
Okay.
Specifically, Dr. Steve Talk. Hey, Mel, this is part of the intervention for Dr. Steve.
Sweet.
There you
Fuck
go.
off.
There you go.
So excited to be here.
Hey, why slowing down is essential for your growth. Ooh. There you go. It's just important that we slow down and appreciate today.
I don't care. My jokes don't go.
It's good for your longevity, and it's good for your personal growth.
I don't remember asking you a goddamn thing.
Scott, you're being abused.
I know it.
He's being abused.
I feel so bad. Hey, we're trying to help
This is all
you here.
directed at me.
We're trying to help you, brother. Aren't we, Mel?
We are.
We're trying to help him.
See, that's the things that are coming out of your mouth, child. Babbling. Insanity.
delusions.
Is that what you're thinking when you? Is that what you were thinking when you were at the ramp? Salt
Yeah,
festival?
no.
the ramp.
Dr. Scott trying to quote unquote help me.
There you go.
Scorn and defiance.
I could change the subject. I brought.
No, that's fine. That's fine. That's fine.
I brought a defining disease-modifying therapy for Alzheimer's.
Okay, well that'll be good, but don't stop.
Okay,
It's,
hey, just because you don't like it, other people might be interested.
Not how sane people act.
All right, number one. Here we go. Create space for stillness. You have to set aside time, dedicated time each day to be still and quiet. And this can be through playing the banjo. This can be through meditation. It can be through walking.
Walking is awesome.
Wow, that is very interesting. Please tell me more.
It gives you a chance to disconnect from all of the constant noise in your crazy brain. But I think that would require turning off your cell phone button. You have to practice mindfulness and engaging in activities with full presence and awareness. Focus.
You get nothing.
And savor
you
the truth.
lose. Good day, sir.
You have to prioritize your self-care. That means taking care of
membrane, bro.
Taking care of
myself on my soundboard. I think that was from when I was on Sam's show.
It's mucous membrane, bro.
That was almost 20 years ago.
Yep.
Here, and let's see how well this goes by him.
Okay.
You have to set boundaries. Oh shit.
See, that's the things that are coming out of your mouth, Chad.
Learn to say no. Exactly.
He's a fucking idiot.
You can say no to commitments and obligations. Whoever's listening to this at this point, if you haven't changed the station yet.
Can you please stop bullshitting?
2 more things. Simplify your schedule, which is a good idea for all of us. In other words, take a step back, evaluate yourself, and finally,
Get your hand off my penis!
finally, drink more liquor, smoke more weed, and take more psychedelics. There you go.
Oh, okay. Well,
There. Wrap it up.
Positive.
There you go.
Can you, shut up?
That is, of course, as long as you don't have any, allergies to alcohol or marijuana or psychedelics, of course.
So, no, that's very good.
Talk about a fucking lead balloon. That's
no, it was great. I thought it was hilarious.
I'm gonna have to do a better job vetting my topics.
No, you're fine.
Scooter's topics of time.
I have my soundboard to help you along. Do you? And you had another thing though about Alzheimer's though that actually is pretty interesting.
Well, I think the first one could be interesting to some people that would take a minute to listen to the topic.
Oh my God, he's still on about it.
Nope.
I don't care.
That was at 3:00.
Oh my God.
Oh my goodness,
that's a great picture. Yeah,
that is awesome. Will you send that to me?
Yeah, I will.
I want people to see this.
That was at.
I don't want to dox you. Oh, there's motion at your back door.
It's probably my kid.
Probably cat.
Or a cat, yes.
Look at that.
It was gorgeous.
That's cool.
Mm-hmm. Yeah, I have much better pictures from up in Alaska, I'll share.
Yeah, but you're supposed to see it in Alaska. You're not supposed to see it in,
Hillbilly.
I wonder how far south that went.
I think this is it.
This was
on the map.
I saw something about Atlanta, Georgia.
Oh, on the map I saw.
That was from my daughter's house.
Okay, if you ever see something like this, will you fucking call me? I had no idea. I was in here.
Should have.
I was taking a Udemy Da Vinci Resolve class. Well, that's incredible.
Yeah.
And there are the curtains on that one.
Oh, yeah.
That's amazing. Yeah, so we knew it was going to be bad, but I was talking to Trucker Andy from WATP, and he said, I don't see anything here. So I didn't bother. I said, well, okay, it's in Troy. It didn't get as far south as Buffalo or, wherever it is, Syracuse.
I will call you tonight if I see anything.
Well. Yep.
It's crazy.
Most guys want to get a booty call, but I'm just like, no, give me a eclipse or a Aurora Borealis call.
God, this thing, that was just before his wake-up call for the Ramp Festival.
God.
Yeah.
Anyway, all right, but tell us about Alzheimer's. We got to get going here.
Real quickly. Yeah, this I found this kind of interesting. They found the mechanisms for how DMT and some of these other things affect Alzheimer's. And the bottom line is...
Sorry to interrupt. Yeah. Chris R. in the chat says that they saw it in parts of Florida.
Awesome.
I think that's... I know when I was a kid, like in the 50s, there was one that hit that they were seeing it in Texas, but that's pretty far south. Mm-hmm. That's amazing. Anyway, so go ahead.
Yeah, sure. Well, that's cool. DMT is an intervention that produces an enduring change in clinical progression of Alzheimer's disease by interfering in the underlying pathophysiological mechanism of the disease process that leads to cellular death. So what it's doing is it's interfering with the cellular death.
Of course.
And slowing the progression of Alzheimer's disease, which is pretty cool.
That is cool.
So that's why they're.
So when will we see this on the market?
Well, that's what they're saying is and as all good studies go, conclusion is more research needs to be done.
Well, that's always true.
Which is true. So hopefully they're going to continue to research the effects of psilocybins at low dose, just kind of like they're doing. Right now we're seeing a lot of the low dose naltrexone.
Naltrexone,
naltrexone for treatment. In other words, we don't have to max out a dose every single time,
right?
Because I hear it every single day. Somebody comes in with who cares what it is? Well, now they said to try this, and if it works okay, then double it next week, and then double it, and especially like gabapentin.
There are some things where that makes sense, but
not everything.
Not everything.
Exactly. Yeah.
Melatonin, you're probably better off doing a lower dose than a higher dose. Yep. And, we make fun of the homeopaths because, they dilute out their medicine to the point where there's literally no medicine in there. But there is some benefit in using lower doses. We hear a lot about microdosing now.
Yep.
And really what they mean is, they're calling like 5 grams of psilocybin or whatever. Mm-hmm. Heroic dose, meaning that you're going to be tripping your balls off.
Right.
So then, when you're taking 0.3 grams, then that's considered microdosing. But it's not really microdosing. It's just dosing for the condition, but it's microdosing compared to tripping your balls off.
Right.
So I'm not a big fan of that term anymore. It's kind of hit me that it makes more sense to just say, we're for depression, PTSD, and stuff like that. If you're going to take a daily dose of a medicine like psilocybin, I'm not advocating it. I'm going to say, in the future, very soon when we have pharmaceutical psilocybin on the market, they'll say it's microdosing, but that's just micro compared to, ball tripping.
Being out of your brain.
Right.
At your gore.
It's actually the correct dose for, depression maintenance.
Right.
Okay.
And to still be functional,
Well, yeah. Well, you can be functional while you're tripping your balls off, but just not consistently. All right. We have some phone calls, so let's...
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings. but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Cool.
Number one thing, don't take advice from some asshole on the radio.
Now, I'm doing some of these blind because I didn't have time to download them, but we've got some others that are downloadable. And did you have a topic? Oh, you're setting the timer. I see.
set the timer.
Okay. So the timer starts when we start to answer the question.
All right.
Because the question itself might be 3 minutes long, and then it's, wouldn't be right.
Moot point.
And then we get 30 seconds to answer.
5637.
Oh.
I'm on Pandora, and they were talking about your broadcast, I guess. But I'm trying to figure out, there's a Viper medicine, and I'm trying to find out more about it so we can put a stop to it.
What the hell? What's he talking about? Viper medicine?
You got to start it over. I could not understand the first thing he said.
Well, he was listening to us on Pandora.
Okay.
And there was something about Viper. They were talking about us. And, there is Ancrod, which is a drug derived from the Malayan pit viper. Mm-hmm. And they give it for people having acute stroke.
Okay.
But that's all I know about. I don't know what Viper medicine he's talking about. Do you guys have any idea?
The only thing I was going to say is maybe a homeopathic medicine that they've
maybe
is Viper Burus, which is they've reduced it down. 5,000
why
times.
did you want to put a stop to it?
I don't know, especially if it's helping people.
Okay, all right. Well, here you go.
Hi, Dr. Steve.
Hey, man.
It's Jason from Louisiana with a curious question. What would happen if you were to receive a blood transfusion of incompatible blood?
Yeah.
Thanks.
I can tell you, it sucks. And when they were first learning how to do blood transfusions and didn't know about this stuff, sometimes it'd work and sometimes it didn't. And the times that it worked was either they were compatible or they were using someone with type O blood or whatever. Okay. And then, but if they gave somebody with type A blood, somebody that had B or AB, all of a sudden the patients died. And so what happens is, like if you have A positive to O negative, it causes the patient's immune system to attack the red blood cells. That's how this works. And this leads to a serious transfusion reaction. It's just like if a mother who is, RH negative gives birth to an RH positive kid, she will make antibodies to that kid's blood. And if you don't treat it with Rogam immediately to block those antibodies, what will happen is that the next baby that they have, she's going to attack. Her body's going to attack it if it's Rh positive, and that's what happened to Anne Boleyn. Anne Boleyn had a baby with Henry VIII, and it was Queen Elizabeth I ultimately, but he wanted a male child, and she got pregnant a bunch of other times, and they all died of hydrops, meaning that her body was attacking the children. The babies, and they didn't know about this stuff back then. So she had stillbirth after stillbirth after stillbirth after that. And, and because of that, because they didn't know about blood types, she ended up losing her head. He chopped her head off and then moved on to the next one. But anyway, so when that happens to the baby, the same thing would happen to the human if you just admix the blood. So you get multi-organ failure, shock, kidney failure, circulatory collapse, and sometimes death. So it's bad. Now, you know something about this.
A little bit.
Okay. Well, did you have some experience with it that it sounded like you were had some experience with this.
I get it, yeah, but the RH stuff, yes.
Okay. Did you do OB?
No.
You never did.
No.
You're just smart.
Just
Okay,
know a couple things.
Yeah,
I helped
yeah.
deliver a baby once, but that was it.
God, I used to cry every time I delivered a baby. I delivered about 250.
Oh, I did. I bawled like a baby.
Yeah.
And the sweet mom and dad, since it was my first, let me cut the cord. It was pretty amazing.
Yeah. Yeah, well, back then we just cut the cord. There wasn't any,
I got to do it.
Celebration. Or
I saw a few interesting
parade.
things in the in the operating room or the delivery room.
Tom.
It's been okay. Yeah, we're done with that
Yeah.
topic. It's been a long time. I really wish I could tell these stories on the air because they are nuts. Just nuts. For example, one where the person before me told me that the patient was not going to deliver tonight because her cervix was only 1 centimeter, which, for people who don't know, the female cervix is where the baby's head has to pass through. And to do that, it's got to flatten, called effacement, and it's got to dilate to get that head through there in the body. And so he said, well, she's just 1 centimeter, so that's tiny. That's, that's the normal. And it was actually an ass. It was...
oh, there you go.
It was the kid was delivering breech right in front of my face, and that was my first delivery as a doctor, and I was freaking out about it. So I would love to tell that story sometime. I have to research if I can, if I can tell that story. It's what I just told you was general enough that I'm not breaking any sort of rules with
He was
that.
measuring the wrong delivery hole.
Well, he stuck his finger in there and
in the wrong hole, right?
Felt a kid's anus and said, "Oh, he's 1 centimeter."
Oh my God!
Anyway, so I've got a million.
I'd like to tell you that surprises me.
I have a million great stories, and it's like I don't know that I can really tell them. So, but anyway, someday. Anywho, all right.
Next,
let's do another blind thing. Okay, that was transfusion. That was a good one. Oh, okay. Did we do the guy with 3 testicles last time?
Yes.
We did do that. Okay. All right. Then. Okay, here's a good one. Oh, this is one for Mel B.
Oh, no.
Oh.
Hey, Dr. Steve. This might not exactly be your wheelhouse. And
it's Mel B's,
fine.
though.
Just wondering if you have any advice for a 35-year-old just about to start nursing school. All right, thanks. Bye.
Oh, there you go.
Okay, so this poor bastard called us in December 19th, 2019.
There you
Blessed. He's already graduated.
So he's
I hope.
already graduated, but he started nursing school right before COVID.
Oh,
rats.
Yes.
Right?
Rats.
So, and let me see. I got to send him a note. Doing your your nursing question now.
All right, so I'm going to answer this.
Yes.
My best advice is learn how to take a test.
Yep.
Yes.
Really?
So test anxiety is real.
Yes.
Nursing school, and I'm sure it's probably the same for medical school.
Well,
and
actually,
things.
there's stakes involved.
Yeah. So when you go to take a test, you have a question. It's all multiple choice. There's some select all that apply, which is a total different subject because that can make you want to eat a gun.
Yeah.
But the multiple choice, you got 4 answers that are right. You've got
let me say something about
probably,
that. Select all that are correct.
Yes.
You should get credit. If there's 5 of them, you should get. That should count for 5 points. So that if you get 3 of them right,
then you get 3, not
you get
5.
3/5, not 0.
I think that you are correct.
Right.
But you got to get them all right. So on multiple choice questions, you got 4 answers. 4 sometimes are right. 3 are definitely right.
Right.
2 are more right, and then you have the one question that is, or the one answer that is the most right.
Right.
So
And
you have
even
to
if it's
find
not-
the best answer. It's not
the right
answer.
answer.
It's the best answer because sometimes they're all right.
Give thyself a bell.
So you practice, take tests, do
Right.
practice tests, do practice questions, get like books and study guides. When I first started nursing school, we had, and I'm about to lose time, I think. No, I got it.
No, wait, no.
So when I first started nursing school, we had one of our professors that she taught a how to take a test class. And for one evening of class, we went in and it was random questions like with fake words that made no sense about the Waka Waka monkey that had a breathing problem. And like based on the question that didn't make any sense, you could pick out key words and how, if you don't know the answer to the question,
how you can dope it out.
You can at least kind of narrow it down to 2. And now instead of a 25% chance of getting it right, you got a 50% chance, that kind of thing. So that was an awesome help to me, is learning how to take a test, learning how to read those questions. And keep in mind, every time you read a question, and it's, you want to say, but what if?
Right.
Forget the what ifs.
Right.
These questions, nursing test questions and probably medical school is in a perfect world. And everything, you have enough staff, you have enough equipment, you have all the things.
Right.
It is a nice little utopia.
Some of them are political questions, and that's the thing you got to think of. Okay, is this organization... Are they egalitarian? Are they thinking about DEI? Are they thinking about this, that, and the other? And so you have to think about those things as well sometimes when you're taking tests. And what I think is you probably don't have to. Just give the right answer and don't worry about what you think they want you to say.
Right.
Just say what's right, and then you can argue it later. Because sometimes test taking questions they get it wrong, and they do a lot. They've got a lot of sophisticated statistics that look at things and say, wait a minute, this question, there's something wrong with it. And they'll throw those out.
Yeah, when you take your NCLEX, it's you get so many questions. Definitely. And then you get a percentage on all these tests. You get a percentage of questions that are not scored. And they're test question. They're testing the validity of the question.
Right.
And if it's a good question, if
a good question,
an educated person can get it right.
What they're a lot of times are looking for, because I've helped write test questions, is a perfect question is one that the people who get a good score will mostly get right. And then the people who get a medium score will, 50-50, and the people who get a bad score will get it wrong. And that way it'll differentiate, because if you have a question that's so easy that everybody gets it right, it doesn't really help you. But the other side of it is, are we looking for people who know stuff, or are we looking for people who are good at test taking? Because why not have a test where the questions are fundamental questions that you need to know? And if everybody gets 100 on it, then that's a good thing. Why is that not a win?
Right. I agree.
So
it needs to be a nice combination of all that stuff.
Yeah.
You need to have that advance. Just knowing an answer does not demonstrate critical thinking,
right?
Which is very needed.
I agree
in
with
this
that.
field, in the medical field, no matter where you're at.
Yeah.
From a PCT all the way up to the medical director.
Yeah.
Everybody needs that.
Yeah. And by the way, NP Mel B doesn't have vocal fry. She's got a fucked up vocal cord from her thing. So I don't want to hear about, vocal fry. No.
Are you talking about my raspy, sexy voice? Yeah.
But it's not vocal fry.
No.
It's actually your voice.
I am naturally that sexy.
I don't disagree. All right. Yeah. So test taking, big thing. And let us know how you're doing. I just texted him. Said, we're finally doing your nursing question.
That's great.
I want to know where he's working, what field, where, is he med surge, ICU, doctor's office? What's he doing?
Oh, this one is like an emergency that was sent to us in 2019. So I'm not going to read that one. But, this one, everybody will love this one. Here you go.
Got a question for you. Took a pretty bad injury.
December 13, 2019.
Oh, God.
Bless it.
A cut on one of my fingers a few weeks ago from a saw. And the wife got all panicky about when's the last time I had a tetanus shot. I haven't had a tetanus shot in probably 35 years.
Okay.
I got to think, what is tetanus? What does it cause? I've never heard of anybody dying from tetanus.
Okay.
What's the dealio? Thanks.
Okay. So I can talk about this. Mel B, you probably can too. So we'll tag team. Tetanus is a condition caused by a bacterium called Clostridium tetani, And I've seen one case in my life.
Wow.
And it was fatal. And that person had never gotten the original 3 tetanus shots. I've never heard, and that doesn't mean it has never happened, of anyone dying from tetanus that had the original 3. But they recommend it every 10 years. If you have a clean wound and it's been more than 10 years, you should do it just because it's been more than 10 years and you need to do it. If it's a dirty wound, let's just say that you were walking in a field and there was a cow patty and you stepped on it and there was a nail in it and it went through your foot, then that is considered a dirty wound or a contaminated wound, and that should you should go ahead and get a tetanus shot then. And there's a whole protocol for it. Do you want to talk?
I'm
about
trying to
different?
Remember because I used to work at the health department.
Yes, that's right. You did all
vaccines all the time. I'm trying to remember. I'm trying to remember if tetanus was one that we gave, I believe, at 1 year of age.
Oh, no, I don't know the schedule.
I can't speak to that because I can't remember. I know we did with kindergarten shots, before a kid starts kindergarten, there's a whole series of things.
Yeah.
And it's about every 10 years. You do it again before kids go in, usually into the 7th grade. And then, when you get to adulthood, people tend to fall off, but it's very important to get the Tdap because it also protects from pertussis.
So the recommended tetanus vaccine schedule is the big T, big P, because there's big T, little T, and all that stuff, right?
Tdap.
So this is diphtheria, tetanus, and pertussis. Pertussis is whooping cough. Diphtheria, you've never seen it, but you don't ever want to see it. It causes a pseudomembrane in the back of the throat, and it's rough. And so this is a successful vaccine because we don't have diphtheria in this country. Matter of fact, most pediatricians have never seen it. But they give it at 2 months, 4 months, 6 months, 15 to 18 months, and then 4 to 6 years.
There you go. That sounds right.
And then big T, little d, you get every 10 years.
Yes.
That's the...
And usually if you've got a major wound and you haven't had if you don't remember when your last Tdap was,
do it.
Then just go ahead and get it. And if you haven't had it in the last 5 to 7 years, go ahead and get it.
Yep.
Yep.
Okay.
And Tom.
Good
job.
Right at 3 minutes. Excellent.
I like it.
All right, let's do this one.
Hey, Dr. Steve, it's Matt in Charleston.
Hey, Matt. How you doing?
Good. We're doing good.
Okay, good.
Hey, I am going through some stuff I had some chest pains, and I went to the ER a few weeks ago.
Okay.
And the ER wasn't able to find the source of those chest pains, or the cause of those chest pains. So they referred me to a cardiologist. All right.
Oh,
cardiologist.
Here we go.
A scan of my chest.
Okay.
And that scan came back, and they said I had a 0 calcium rating.
Okay.
Which I don't really understand what that is, but they said it was good.
Yeah.
So,
well, they did a calcium score, and they did this, Agatston score or whatever it's called, and that thing will not find non-calcified plaques, but it will find calcified plaques in your heart. Remember, recently I had mine. I thought it was 600. Well, it turned out the person who read it originally effed it up, and it was actually lower this time than it was when I had it done 5 years ago. So good for me, but stupid for them. God, I was freaking out. But anyway, so yeah, that's what they did. They did a calcium score.
And normal calcium score is 0.
Correct.
So that's good that this guy had a 0.
And then he was blaming it on me that this calcium score went up.
No, because you told me to stop taking my statin, and I listened to you like a fool. But anyway, no, it's... I did okay, so thank you.
I don't really understand what that is, but they said it was good.
Yep.
So they're still doing some testing and blood work and all that. But what's with the calcium rating, and what does it mean, and what would be a bad calcium rating? And if it works,
0. 600.
Yeah, right. So,
okay.
You want to talk a little bit about atherosclerotic cardiovascular disease? We got about a minute.
I mean, I can.
Okay.
Take care of your heart.
Yeah. Okay. Well, okay. Thank you.
Yeah, you're welcome.
Atherosclerosis, fatty buildups.
So the Agatston score is this number, and it looks at the total area of calcium deposits and their density in the heart. And it can range from 0, which is considered good, to over 1,000. Now, 0 means no calcium, low risk of heart attack. Not 0, not 0 chance of heart attack, because again, you can have non-calcified plaques. And then 1 to 10 is minimal, 11 to 100 is mild. And then I started off around 2. I started at 0, and then I wasn't taking a statin for the longest time, and advanced up to like 275. So that's considered moderate. 101 to 400 is moderate, and you have moderate chance of heart attack. But if you look at my Framingham score, which is the one I go by God, because it makes me feel better, and you can just go Google Framingham calculator and put the numbers in, I have a 2% chance of having an MI over the next 10 years, whereas at my age, the normal is 8.
That's good.
There you go.
And then over 400 is severe calcification, large amount of plaque, high chance of atherosclerotic cardiovascular disease event, which is when that lady told me it was 675, I was shitting myself. Almost not quite as bad as I was shitting myself at the ramp festival that didn't have any ramps. So there you go. Little callback, ladies and gentlemen. Thank you. All right, Dr. Scott and Mel B. Before we get out of here, we should hit the chat room. So if you want to join the Fluid family, go to youtube.com/@weirdmedicine. And I've got John's ear mites. Thank you for being a member for 3 months. And when you come in, turn on your gifted memberships. If you just click the join button, you can click accept gifted memberships. Myrtle Manus gave 10 gifted memberships today. And SG Fanboy gifted 10 Weird Medicine memberships. They're just 99 cents. So it's not like doing it on Bedabbler's network. I gifted 10 memberships there because I couldn't be on his show today after he asked me. So I, gifted. It was like $40.
Oh,
like, dude, yeah. So anyway, and that's what I've got. Now, have you got some questions that you've culled from there, Dr. Scott?
Are we ready for them?
Yeah, absolutely.
Yeah, so
sure.
The risk would like some recommendations on derealization. The risk has terrible anxiety, and it's getting worse and hard to deal with. So what are some things we can do for treatment of, I was going to say, if we're just talking about general anxiety.
Well, derealization is a real thing. That's kind of a different thing. That's where people feel like their surroundings are not real. And that takes some, it's a DSM-5 diagnosis. It's called depersonalization disorder, and it's kind of a recurring sense that your surroundings are not real. And because of that, because the intellectual part of your brain knows that it is, and then the more you read about things like quantum physics saying that the universe is not local, so it may not be real, it makes things worse. So, it requires, therapy, talk therapy, and a combination of certain medications. And it might be antidepressants. This person could be a candidate for what Mel B likes is the Trip app.
Yes.
I wonder if that would make it worse, though, because you're being taken into a virtual world with the Trip app. It's a virtual reality meditation app, but it may also center them too. I don't know. I hesitate to just recommend it without them talking to their therapist about it. But, I also wonder if, in the future when we have true psychedelic therapy, if that would make it better or worse, because you can give people enough psychedelics so that they actually feel that they're outside their body. And you can say, this is what it really feels like to be, for things to be unreal.
Just to show you what really would happen.
And when they come back, maybe they would be, I would be really interested in seeing studies on that.
Well, just to talk about that for a real quick second, what they talk about the psychedelic therapies and the microdosing, it helps to kind of reset your brain.
Yeah,
and I think those are things, and they will do interventional stuff like the stellate ganglion blocks for some people with the serious anxiety disorders.
Yeah, talk about that.
It might be
talk
beneficial.
About stellate.
Yeah, there's
ganglion
a little a nerve bundle that's in your neck. It's just above your first rib. It's near your carotid artery. That someone that's really trained with and has a fluoroscopy or ultrasound can go in and identify where your carotid artery is, and this little bundle of nerves right above your first rib, and can inject a little numbing agent right into the right above the nerve bundle, and it can help to calm anxiety and to reset the communication between the body and the brain. And they use it a lot in the military, and they've had some success with that too. So I mean, outside of the normal stuff, you'll hear people talking about exercising and
it's crazy
diet
that this
changes
little bundle
and stuff.
Of nerves, just numbing it up, the benefits that can have. But they've been doing it for like 100 years.
Yeah.
They use, as Dr. Scott said, ultrasound to find it.
Just make sure they hit the right spot.
Well, yeah, but for 50, 75 years before that, and why they thought that this would work.
So that's the funny part. Yeah, why?
They were just doing it by you just stick your finger on the person's neck and inject it, but they use it for PTSD, long COVID, chronic fatigue syndrome, also called myalgic encephalitis, and it's good for head and neck pain too.
Yeah, sure.
I would love to learn how to do this because this is right up our alley. It'd be something like this. Mel B and I are in the same specialty, so I would love to be able to do this. Maybe we need to find a place where we could get some training on it, and then we could maybe
That'd be awesome.
do those.
I'll go.
Yeah. Okay. Yeah, we'll go together. Excellent.
All right. Last one.
Yep.
McRibs. I asked my doctor for a shot, and he then asked me if I work on a farm, so I stepped right into his trap. I am from the city, but then he got to tell me the urine on a rusty animal fence theory to me. So,
I guess he was talking about a tetanus shot.
Tetanus shot, yeah. So I would assume that's what I was talking about.
Well, okay.
Yeah. You can't get tetanus living in a city. You don't have to just
fucking flippant answers when they ask you a serious medical question.
Exactly.
And you live on a farm if you don't. And
you don't need it.
You ever have any corn squeezings? Well, you don't need no tetanus shot, Lynn. It was stupid.
It is stupid. Yeah, you can tetanus.
Number one was he due if it's been more than 10 years. And honestly, if you live in a city now and you cut yourself on the street, you might be getting, it might be an infected.
You might need to worry about something other than tetanus.
Yeah.
That and.
I got chlamydia off of a nail that I stepped on the middle of the street. So, I don't like that. I don't like this sort of dismissive answer that a lot of doctors, well, not just the doctors, NPs and PAs, just medical professionals give to people. We have this privileged position, and don't abuse it and give people flip-ass answers. Now, that pisses me off. I'm going to be mad the rest of the day.
You mean the ramp festival without ramps?
No, that
didn't do it for you.
That was funny. It was a fun trip, and
you got some cool T-shirts. That's the best part.
Yeah, well, Joanne and Tacie are getting them from fucking Mother's Day.
And I will tell you, the last time you made ramp salt, it was so good but so strong. I still have plenty left to get me through the next calendar year.
Much.
It doesn't take that much.
It doesn't take much, but I'm out. I gave it all away knowing that I would be making more. So,
oh, Lord.
Stupid. Anyway,
oh, well.
All right. What are you going to do? Well, we just go to the farmer's market to get our... This is the Ramp Festival. What are you talking about? You don't have ramps.
Oh my gosh, that's funny.
It was everyone there was delightful. I think it would be fun if I hadn't gone there with the expectation of coming away with a garbage bag full of ramps. That's the thing.
Oh my gosh.
I think they had them. I just misunderstood what the festival was about. It's like the apple festivals. You don't just go there to buy apples. You go there to get things, apple pies and apple this and that.
Apple
it's not
butter.
Apple butter. Yeah.
You're not there, and
apple fritters.
Right. You don't just come out of there with bushels of apples. So that was stupid of me. It's not their fault.
It's okay.
I just had expectations that were dashed to the ground.
I have a question if you've got time.
Yes, of course. 3-minute timer starting now.
Okay.
No, I'm just kidding.
Colon cancer. I was asked if having an appendicitis and your appendix removed increases your risk of colon cancer.
Okay. Do you have an answer for this?
Maybe. Was
Okay.
the only thing that I came up with. I found a couple, what journal is this? The Journal of Clinical Medicine. Said basically maybe. There was a...
Why?
Well, so it made me think, well, what does your appendix do? Which I should really know, but I had to think a little bit.
Holy moly. Okay, I just found some data. Go ahead. You tell yours and I'll tell you mine.
Yeah, so it might be the same data I have. I don't know. So the appendix, has good bacteria housed in it.
Right. Well, and it has lymphoid tissue in it as well, which is, immune modulating.
Right. So when you get sick or have a stomach bug or you've got, you take antibiotics and your good bacteria, bad bacteria gets all out of whack, maybe the appendix helps set that back to right.
Interesting.
So then that made me start thinking about probiotics for one.
Yeah.
And if you don't have an appendix, maybe you should take probiotics.
Well, maybe. We don't have any data on that. But
and what does this have to do with colon cancer?
Everyone should drink kombucha, in my opinion.
Yeah.
So,
but there was a study that I found that studied 49,000 plus people with and without appendix.
Okay.
And what the difference was. So after 15 years, it looked like a little over 1% of cases with appendicitis had a 0.6% cases of colon cancer, whereas without the appendix, newly diagnosed with colon cancer, 36. That's not what I was looking for.
Boo.
No, it was 0.6 versus 0.01.
Okay.
It was
Pretty small.
a little bit of a higher risk for people without an appendix. Without an appendix.
Well, here's
slightly higher.
Here's something from the from Lancet, and they're looking at appendicitis particularly.
Okay.
Patients treated for appendicitis presented 4 times higher risk of being diagnosed with colon cancer than the control patients during the first year of follow-up. So that tells you, it's inflammatory most likely. But here's a 2020 meta-analysis found that appendicitis increased the risk of colon cancer by a factor of 10.
Wow.
And a 2023 study found that patients treated for appendicitis had, again, 4-fold higher risk of being diagnosed with colon cancer within the first year, 8-fold higher risk within the first 6 months. The risk was higher for patients under 40 and for obese patients. What the hell?
That was odd.
So I learned something today.
I
would have said, nah.
Interesting, because I don't have an appendix, nor does a majority of my family. So both my kids, my brother, my dad.
Is there colon cancer history in your family?
No, but I've had some significant polyps that have been removed and actually have to get a colonoscopy every 2 years.
And so that's the point I was going to make, is that knowing that you're at high risk means you're less likely to die from it.
Right.
Because if you do the surveillance like you're supposed to.
Yep. Scheduled for my colonoscopy coming up in a couple months.
I have a friend with familial polyposis. This is, he just makes polyp. He's at extremely high risk for developing colon cancer. But because he gets his colonoscopy every year, the chances that he will die of colon cancer are almost zero.
Which, when I freaked out the first time I had my colonoscopy and got some news that I had precancerous polyps.
Yeah.
I was panicked thinking, oh, this is it. I'm going to die. And that's what you told me. No, you're not. Like, if you go and get your colonoscopy, you will not die.
It's actually good.
Yeah, it'll be good.
That they found that.
Yeah.
Yep. Yeah.
So I go. It's no fun. The prep sucks.
Oh, I like it.
Oh, I love it.
Oh, God, no. No, I'm a puker. So it doesn't matter if I'm emotionally upset, if I'm like really, really happy about something, any kind of emotion, anger, I'll puke. If I smell something, I'll puke. I'm a puker. So the prep makes me puke.
Oh, it does.
Yes. It took forever. I had to take they ended up giving me Haldol before my colonoscopy.
I like the...
Haldol? Yeah, because I couldn't quit throwing up.
Yeah. Yeah, it's good antibiotic. My favorite colon prep thing was when they had no filter Paul, and back when they had Fleet's phosphosoda, which was just a little 3 to 6 ounce bottle, and they made him drink one, and they put Club Soda Kenny, who was a big imposing guy at the door, and said, now you can leave, but you got to get past Kenny. And they had him in a diaper in a kiddie pool, just standing there in the studio until this stuff, because Fleet's phosphosoda works like a tsunami through your bowels. It starts at the top and it just rolls and it gains strength and it picks up more fluid. And then by the time it hits the sigmoid colon, which is right before the rectum, it is a powerhouse. And he just shit all over everywhere. It was unbelievable. And it was within, 30 minutes to an hour. So.
What a horrible idea.
Yeah. I like the prep, though. The last Fleet's phosphosoda prep that I did, the last time I hit the pot, I was just shooting water out of my rear end. And, I could have hit a wall 20 feet away. It was so powerful. And I got up and I looked down and the water was as clear as a mountain stream. There was nothing in it. No particles, nothing. It was just pure. I think you could have drunk it. I'm just saying.
Thank you.
That's how clean it was.
Yeah.
It was amazing. That's so crazy. But anyway, all right. Now we grossed everybody out. So
cool.
Sweet.
All right, my friends.
There you go.
Thanks. Always go to Dr. Scott. Thanks, Mel B, for being here. Thanks to everyone who's made this show happen over the years. Listen to our Sirius XM show on the Faction Talk channel, Sirius XM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.